This is the Lone Crater YouTube. We hope this video helps.
You start by confirming the exact order and concentration so dosing is safe. Check patient identifiers and allergies. Once done, open gloves and arrange syringes, needles, vials, and diluent in a sequence that prevents mixing. Make sure labels are ready and a log sheet is visible. You want a clear aseptic field. This minimizes contamination and speeds the next steps. So position everything within reach and discard packaging immediately to keep the space sterile. You now measure and dilute with care because accuracy determines test validity. First, use a calibrated syringe to draw the required volume. If dilution is needed, add sterile saline using the prescribed ratio, for example 1:10. Once mixed, invert gently to homogenize. Do not shake vigorously, which creates bubbles and dosing errors. Make sure to verify calculations and lot numbers allowed and document volumes on the log. This prevents dosing mistakes and preserves traceability. You finish by labeling every syringe with the drug name, concentration, time prepared, and your initials because clear ID prevents administration errors. Administer according to protocol, then document the site, time, and immediate patient response to capture baseline. Dispose of needles in a sharps container and store any remaining medication per facility policy with lot and expiry logged. Troubleshooting tip: if results look inconsistent, recheck the dilution math and expiration dates first.
Thanks for watching. Consider subscribing if we helped you.